Have you noticed a strange spot, patch, or bump on your skin lately and ignored it? What if that one small change was the first red flag of undiagnosed diabetes? Thousands of seniors mistake these as normal aging, while inside, type 2 diabetes or prediabetes is silently damaging blood vessels, nerves, even kidneys. According to the National Institute on Aging, over 30% of people over 60 develop skin symptoms linked to diabetes, but most don't recognize them until it's too late. In this video, I'll show you 5 skin signs that could be your body's silent cry for help. And sign number 5 is the one most seniors ignore, but it's the one doctors worry about most. So don't look away, because what you learn in the next few minutes might protect your eyesight, your feet, or your life. Click subscribe so you can catch every early warning your body gives you. Now, let's begin with sign number 1 and why it's far more serious than it appears. Sign number 1. Dark, velvety patches on the skin. Acanthosis nigricans. Sometimes the earliest sign of diabetes doesn't show up in your blood test, it shows up on the back of your neck. It may look like a shadow, or like your skin is dirty, but it's not. It's a condition called Acanthosis nigricans, and it's often the first visible clue of insulin resistance, especially in adults over 60. This patch usually feels soft and velvety, but the message it sends is anything but gentle. It means your body is producing too much insulin, and your skin is responding by thickening and darkening in the folds, neck, armpits, groin, or elbows. It doesn't itch, it doesn't hurt, and that's what makes it dangerous. It often gets dismissed as simple pigmentation or aging. Imagine your skin like a warning light on your dashboard flickering before a real breakdown happens inside. According to Harvard Health, this sign is strongly linked to type 2 diabetes and prediabetes, especially in seniors who are overweight or have a family history of metabolic issues. Comedian Sherri Shepherd once shared that it was a weird patch on her neck, not a lab test that led to her diabetes diagnosis. She only went to the doctor after a friend noticed it and urged her to get checked. If you notice this kind of skin change, don't wait. It's important to speak with your doctor and request tests like your A1C, fasting, blood glucose, and insulin resistance levels. These tests can help determine whether your body is struggling to process sugar effectively. The earlier you detect the problem, the more options you have to manage or even reverse the course of prediabetes before it turns into full-blown type 2 diabetes. Do you know someone who has a dark neck patch and hasn't seen a doctor about it? Tag them or share this video, it might be the gentle nudge they need. But that's just the beginning, because the next skin sign often hides in plain sight, and most seniors mistake it for something harmless. Sign number 2. Dry and itchy skin. A silent signal from high blood sugar. Last spring, Mr. Robert Jenkins, a 68-year-old retiree from Ohio, began scratching his legs every night. He blamed it on the weather, dry air, maybe a new detergent. But over time, the itch turned into red, cracked skin on his shins and arms. Nothing helped. His wife insisted he get it checked. The surprise? His fasting blood sugar was over 140 mg/dl, and his A1C was 7.1%. He had type 2 diabetes, and this dry skin was the very first clue. This isn't rare. According to the Mayo Clinic, high blood sugar can quietly dry out your skin from the inside. When glucose builds up in the blood, it pulls water from your tissues, leaving your skin dehydrated, less elastic, and more prone to cracking. Think of it like a sponge left out too long. It gets stiff, brittle, and eventually breaks. For seniors, this is especially dangerous. The skin naturally loses oil glands with age. Add diabetes to the mix, and your skin becomes a perfect storm for itching, flaking, and even infection. Dryness tends to show up first on the lower legs, forearms, and hands. You might also feel a burning or tingling sensation, signs of nerve irritation from high blood sugar. Here's how to protect your skin. Apply rich, unscented moisturizers with ceramides or urea right after bathing. Limit showers to 10 minutes using lukewarm, not hot water. Drink plenty of fluids, even mild dehydration worsens the problem. And most critically, if dry skin persists or worsens, ask your doctor about testing for prediabetes or type 2 diabetes. Have you or someone you know experienced unexplained dry or itchy skin? Share in the comments. Your experience could help others recognize the warning signs sooner. While dry, itchy skin can feel like a nuisance, the next sign might seem even more harmless, yet it could be waving a red flag about your insulin levels. Sign number 3. Skin tags. Small growths. Big warnings. They don't itch. They don't hurt. But those tiny, soft, flesh-colored bumps on your neck, underarms, or eyelids might be saying more than you think. Skin tags are one of the most common and most ignored diabetes symptoms in older adults. They often appear where your skin folds or rubs together, like the neck, groin, or under the breasts. Many people assume they're just a harmless part of aging, but multiple studies have shown that a high number of skin tags is strongly associated with insulin resistance, the condition that often leads to type 2 diabetes. Here's why. When your body struggles to use insulin properly, it starts producing more of it to compensate. This excess insulin stimulates the growth of skin cells, particularly in high-friction areas. Over time, this can cause tiny outgrowths called acrocordons or skin tags to form. On their own, they may seem insignificant, but if you suddenly notice a few new ones popping up, especially in clusters, it could be your body trying to alert you that your blood sugar isn't being managed well. Let me share a real example. Frank, a 69-year-old retired mechanic, noticed a cluster of skin tags under his arms. He thought nothing of it until his daughter, a nurse, urged him to get tested. The results? His fasting glucose was 140, and he was diagnosed with diabetes. So, if you notice more of these small skin growths, especially in new areas, don't brush them off. Talk to your doctor. A quick skin check could lead to an early diagnosis and help you prevent serious diabetic complications down the line. Before we move on, if a tiny skin tag can reveal a hidden danger, imagine what one click on like and subscribe could unlock for your health. Tap it now and stay one step ahead. Now, let's take a closer look at another subtle skin sign that often shows up on your legs, one that's linked to silent damage in your blood vessels. Sign number 4. Diabetic dermopathy. The Shin spots. According to the American Diabetes Association, over 50% of people with long-term type 2 diabetes develop a skin condition called diabetic dermopathy, most commonly seen as light brown, round or oval patches on the shins. These spots are often dismissed as aging, old bruises, or nothing serious. But they may be your body's quiet cry for help. Let's look at what happened to Harold, a 72-year-old Army veteran. He noticed small brown marks on his lower legs and chalked them up to years of hiking and old injuries. They didn't hurt, so he ignored them until a minor scratch on his shin refused to heal. After a visit to his doctor and a vascular screening, he was diagnosed with diabetic neuropathy and poor blood circulation. His A1C was over 8.5%, and those spots, they were the first visible sign of deeper blood vessel damage. Diabetic dermopathy develops when chronically high blood sugar weakens the small blood vessels that supply your skin. This results in poor oxygen and nutrient delivery, making the skin thinner, discolored, and prone to injury. While the patches themselves are painless, they signal trouble beneath the surface, especially in seniors with long-standing or poorly managed diabetes. They usually appear on the shins but can also show up on the thighs, arms, or feet. And the danger isn't the spot itself, it's what it represents. Compromised circulation, increased infection risk, and slow healing. Notice new brown or reddish spots on your legs? Don't ignore them. Ask your doctor about a circulation check. Early action could prevent serious diabetic complications. Now we've arrived at the sign I warned you about at the very beginning, the one most seniors overlook, but doctors pay close attention to. Sign number 5 reveals itself as a stubborn wound that just won't heal, and it could be your body's loudest cry for help. Let's take a closer look. Sign number 5. Slow healing sores. The symptom doctors never ignore. According to Dr. Laura Kim, a wound care specialist with over 25 years of experience treating diabetic seniors, more than 70% of her patients with severe diabetic ulcers had signs of poor healing weeks before they sought help. If they had come in just 10 days earlier, she explains, we could have avoided major interventions, in most cases even amputations. That's why doctors always pay attention to this critical skin sign: sores that don't heal. It might begin as something small, a blister from walking, a scrape on the shin, or even a toenail injury. But if you're living with type 2 diabetes after 60, your body's ability to repair itself is slowed down. Diabetes affects both circulation and nerve function, so you might not feel the injury, and your blood might not deliver enough nutrients to heal it quickly. Left untreated, this can lead to serious infections, gangrene, and in severe cases, amputation. What does it look like in real life? A sore or cut that sticks around longer than 1 to 2 weeks, especially on the feet, legs, or toes. It may become red, swollen, or even start to leak fluid. You may also feel numbness or tingling, a sign that nerve damage is already underway. To stay ahead of this risk, check your feet daily, even using a mirror or asking a family member to help. Wear soft, well-fitting shoes and moisture-wicking socks to reduce friction and irritation. And if you notice any wound that isn't healing, don't wait. Talk to your doctor immediately. Because as Dr. Kim puts it, one ignored sore today can become tomorrow's emergency surgery. Ever spotted a stubborn sore that just wouldn't heal? Let's talk in the comments. Your insight could be the nudge someone else needs to take action. If you've made it this far and haven't skipped over any of the warning signs, that alone is a powerful step. It means you're choosing to stay informed, take control, and protect your health before things become serious. Today we uncovered 5 skin symptoms that could be early signs of type 2 diabetes. From dry, itchy skin and harmless-looking skin tags, to dark patches, slow-healing sores, and changes in your legs that reveal hidden blood vessel damage. These may seem small, but left unnoticed, they can quietly lead to serious complications affecting your eyesight, circulation, and even your ability to walk. Don't wait for things to get worse. If you recognize any of these signs, talk to your doctor. A simple skin check could change everything. If this video helped you, please give it a like and click subscribe so you won't miss the next life-saving tip. You're doing something important just by being here. Keep taking care of yourself because your health is worth it. Always.